Look at this.
Dr. Fairfield, please contact
That's the first tailored white coat I've ever seen.
Where's the halo?
Think he knows anything?
He knows how to dress.
Well, it's my student. I'll find out. John Carter.
Yes, sir.
Peter Benton. You the surgical student?
Yep, third year.
Good. We're going to be spending a lot of time together, so let me show you around so you'll be oriented. This is the admitting desk. If you need someone paged or a chart called up, you do it here. This is Timmy. Don't shake his hand. He's afraid of disease. This is the way to the lab. We do crits, counts, spin downs. Chemistries are marked with these slips and left at the front desk. Mark everything stat, whether you want it fast or not. The chem lab is 7022. The heme lab is 6944. Memorize it. Everybody gets an IV the minute they walk through the door. Use an angiocath with a 16 needle. You need a large bore in case they're bleeding and you need to transfuse them. Do you know how to start an IV?
Actually, no.
I thought you were third year.
I am, but all I've done is dermatology and psychiatry.
The well-dressed specialties, huh? And you find that surgeons actually try to help people, not just build them. Now, the best way to do this is to pull the skin tight so the veins don't roll and go in low. Once you're in, pull the gizmo out and hook it up to here. This is Carol Hathaway, the head nurse. John Carter.
Hi.
She's terrific, isn't she? She goes with an orthopod that used to be a Big Ten tackle and looks like King Kong. Now, what you want to do is you want to tape it, moderate flow, 2 or 3 drips per second. That's it. That's all there is to it. Okay?
Okay.
All along here, you have the medical examining rooms. This is where the pill pushers kill their victims. But this is the surgical room. This is where the real action is. We use this phone to call the OR, 6440. X-ray is around the corner. They're a bunch of idiots. They scare the patients and make them wait too long. So whenever you can, make sure you go with the patients to X-ray. Don't let them get scared. Don't let them get hurt. Here's Dr. Morgenstern. He's the head of ER. Watch out. He eats students for lunch.
David Morgenstern.
John Carter.
When did that severed hand go up?
A vascular took it up an hour ago. I just hope they can do it right.
Dr. Benton is one of the best residents we have. You learn everything you can from him, except attitude.
He didn't mean that.
Yes, he did.
Your room will be down here. That's where you'll sew people up. Do you know how to suture? No. Okay, I'll teach you. Do we have anyone to sew up?
How would I know?
You know, I love this great spirit of camaraderie. Everyone wants to help, you know. Okay, here's the suture room. Let's see. Good morning, ma'am. I'm Dr. Benton. This is Dr. Carter.
Good morning.
Okay, let's have a look. How'd you do this?
Broke one of the breakfast dishes.
Oh, don't worry. We'll have you fixed up right away. Now, can you feel this?
Yes.
Can you move your finger?
Of course, it's just a cut.
Dr. Benton, we have a policeman coming in with a gunshot wound to the lower extremity.
Put him in room 2, notify X-ray, I'll be right there. Now, here's all your stuff. Ask the patient if she's allergic to the locals or any drugs. And this is lidocaine, we'll call it Novocaine, they've heard of that. Ma'am, are you allergic to Novocaine?
My teeth are okay.
No reactions, rashes, anything?
No, of course not.
Now you inject both sides of the wound, expelling as you go. And you have to put on surgical gloves by yourself. You know how to do that, don't you? Great. Here we go. Invert the wound edges and space them because the tissues will be swelling over the next 48 hours. Space them the way that you see here.
Dr. Benton, the policeman's here.
Okay, I'm coming. Here, you finish.
Okay, this isn't gonna hurt at all.
You still here? What do you think you're doing? Assisting Chapel? Finish her up, start an IV in room 2. Bye, ma'am.
Nurse, could you bandage this for me, please?
Thank you, Doctor.
You're very welcome.
When do I come to have my stitches out?
Oh, 3 weeks.
When my son had stitches in his foot, they said 10 days.
Really? Well, 10 days, 3 weeks, anytime in there. Okay.